We're live. Hello, Facebook. Hello, Instagram. Tap, tap for TikTok. I'm pumped to be here. Sorry for missing last week. I was in London and I was on a flight and I just wasn't sure if I was going to make it. But I'm here now. You guys have been great, giving me a lot of really good questions. The inquiries are just growing. We'll be here every Tuesday for the summer. Question and answer. I'm Dr. Rob. Of course, during the whole process, let me know where you're from. Love to hear where you're from, East Coast, West Coast, continent, etc. Let's dig in. First question is, very nice. Someone said that they love the content about the recipes. More. Everybody always loves a good recipe. So here we are. I took a recipe out of Immune Reboot 2022. One of my favorite breakfasts. Yum. Overnight oatmeal with berries and almonds. Half a cup of old-fashioned gluten-free milled oats. Now, we all know that oats should theoretically be gluten-free, but they're not always gluten-free because some people use or mix the oats in a reaper with other wheat. So gluten-free rolled oats, half a cup of organic blueberries, mixed berries, half a cup of organic raw almonds, a half a teaspoon of cinnamon, 1/2 a cup of oat milk, Elmhurst milk or milk malt, MALK, or you can always make your milk homemade, 2 teaspoons of coconut sugar or allulose. You mix them in a jar, put them in a lid. You don't have to cook anything, refrigerate it overnight. Takes you like 2 minutes. Wake up in the morning, it's good to go. There's your recipe for the day. Next question, and guys, gals, anybody, feel free to ask any questions. I've got my panel right there. I'm happy to answer any questions you guys may have. Can functional medicine help with pain management and how? Actually, it's weight management. Somebody just sent it in. Terrific. Well, yeah, I mean, first of all, functional medicine, the idea is root cause resolution. We've talked about that. I believe in functional nutrition. I believed in individualized, personalized lifestyle medicine. So weight management without question, because it's choosing from a bevy of much better options: fruits, vegetables, whole foods, getting rid of ultra processed foods. But some of the tenets of functional medicine that are critical are that you want to fix your guts, you absorb better. When your gut's absorbing better, you're going to get more nutrients. You're not going to feel hungry after you eat. You're going to have better hormonal communication between your gut and your brain. You're also going to have a better communication between your gut and your liver. Therefore, you're going to be choosing better foods. You're going to be burning at a higher rate of metabolics. And functional medicine, functional nutrition, individualized, personalized lifestyle is the way to go for weight management, and more so than weight management, really body contour. What are the benefits of a plant-based diet? Let's just cut it right there. What are the benefits of a plant-based diet? I was watching Sunday night. CNN had a great special on Alzheimer's, and they talked about it being a lifestyle condition, meaning you can change. You can not only stop Alzheimer's, but you can reverse Alzheimer's through a lifestyle. And it was all Dr. Dean Ornish's plant-based diet. So I'm a big plant-based diet person. I prefer plant-forward. So plant-based means all you do is really eat plants. Plant-forward means that you base the bulk of what you do on plants, but you'll eat other things like I'll have eggs, I'll have some grass-fed beef, some bison, some poultry, and the like. So I'm a big believer in plant-based. And again, the next notch, the evolution, plant-forward based diets. What are the key differences between perimenopause and menopause? Another great question. I just wrote an article that was on the cover of Chiropractic Economics. We will put it, not yes, that will do it. We'll put it in the comment section so everybody has access to it. It's going to be coming out on next Tuesday's post. So here we go with the difference between perimenopause and menopause. Number one, perimenopause usually occurs when a woman reaches her mid-40s. Now, interestingly enough, there's some signs and symptoms of that 7 to 10 years. So if you're a 35-year-old woman, you could be looking at some early signs and symptoms of perimenopause. Gradual diminishing of estrogen really is typically seen in a perimenopausal state. Less progesterone. You're decreasing the number of eggs in your ovaries. Perimenopause ends after a woman has her last menstrual period for a year. And now you're in what they call menopause. So segue to the next question. What's the most efficient ways to manage menopausal symptoms? Well, both perimenopausal and menopausal both are going to use ashwagandha. In addition, perimenopausal are going to use milk thistle. Menopausal, you're going to use black cohosh, a stress formula, vitamin D3 with K2, pre and probiotics, anything that's going to balance your hormones. So estrogen is detoxed via the liver. So anything that's going to help with liver detoxification is going to be a great hack, if you will, a great way to deal with menopausal type symptomology. You want to regulate your surroundings. So one of the biggest things in that menopausal issues, or one of the number one symptoms, is hot flashes. People complain bitterly about it. It is a fact. You also want to adopt a new dress code, maybe wear some looser clothes. You don't want anything too tight, being that you're feeling really warm. Set a nightly routine. So you may want to take a shower before you go to sleep to feel more comfortable, to sleep colder so you get better sleep. And last, consider food and beverage choices. Obviously, maybe not a hot tea, but a cold tea late at night may be a better choice. Instagram, how we doing? Facebook, how's everything going? Tap tap. Or TikTok. You have any questions, feel free, put it up on the board. I'm happy to work with you. So this is a commonly asked question all the time. What types of magnesium are good for which functions? I've answered it a few times, but it comes up every week. I think there's value into repeating it. Number one, I'm a big believer in magnesium bisglycinate as your everyday magnesium. A bisglycinate means that it comes with two different glycines, amino acids. By attaching magnesium to an amino acid, you avoid all gastrointestinal upset. Magnesium citrate, 600 milligrams, is outstanding for headaches. However, when you take magnesium citrate, 800 milligrams or more, you now have cured your constipation and made it into a laxative form mineral. For me, magnesium is a miracle mineral. And last but not least, there's something called magnesium L-threonate. Magnesium L-threonate was studied exclusively at MIT about 8 years ago and was shown to really help with brain function, synaptogenesis. It decreases brain aging by 9 to 14 years. It enables magnesium to get into the cerebral spinal fluid, and it's the best form of magnesium to pass the blood-brain barrier and enrich the brain with magnesium, slowing down a lot of neurodegenerative diseases. I take both magnesium bisglycinate and magnesium L-threonate daily. What role does diet play in managing chronic pain? A lot of people always ask me, how important is diet? Well, diet is probably the most important lifestyle hack. It's something that we do 24/7, 365. Good food is a potentiator for health information. Bad food is a potentiator for inflammation inside. So we need to really choose wisely. So again, you've heard me say this every week, let's avoid ultra-processed food. Let's eat more whole foods. If you were to do just that, you would be so far ahead of the American bar now as far as diet is concerned. So some of the things you want to avoid are fried foods. In addition to that, gluten, dairy, added sugar, artificial sweeteners, artificial colors, and the like. You do all those things, your inflammation will decrease. Without question, eating good, healthy, wholesome foods quell inflammatory pathways. So then I have a plethora of questions on laser. I really had a lot to choose from. It's great that everybody knows that I love to use non-thermal low-level laser. My laser of choice or company of choice is Zirconia. I use all the different lasers. I use a GVL, which is a green-violet laser. I use the EVRL, which is a Zirconia violet-red laser. I use different FXs, 635 and 405. They have a great choice of different wavelengths in them. I was fortunate enough to do an FDA clearance on 2 different studies. I'm real happy about that. And anybody has any questions, obviously you're asking a lot of questions, we can go into greater detail. So how can low-level laser help chronic pain management? You know, the first FDA clearance that caught my attention was an FDA clearance for decreased pain an increased range of motion. So a non-thermal laser works vastly different than some of these higher level lasers in that they're not heating and they provide a photochemical reaction like photosynthesis of the body. The body absorbs the photon that's emitted by the laser. It absorbs it into the body and stimulates a healing process or a cascade of increased ATP efficient production, oxygenation, and neurotransmission. It creates an anti-inflammatory milieu in the body while also providing needed energy to allow the body's structures to heal. It's a fascinating device. I do recommend everybody find a practitioner that has an FDA-cleared non-thermal low-level laser. How can laser therapy be used to treat arthritis? You know, interestingly enough, arthritis is the body's response to inflammation, or a poor response to inflammation. We've heard of rheumatoid arthritis. That's autoimmune. Most of these arthritis are really autoimmune. Osteoarthritis, breakthrough, is an autoimmune response. It's the body's inability to respond to inflammation appropriately. So therefore, anything that is able to quell inflammation and not let it run rampant, like a low-level laser, is really the backbone of what you want to use the laser for and why you wouldn't have an arthritic condition with it. How effective is laser for skin rejuvenation? Well, I don't want to say it's a longevity organ. I don't want to say it's like taking Botox, but it is used for skin rejuvenation because it's allowing, again, that ATP production. The second question was muscle recovery. Now, in 2016, there was a study because low-level laser, non-thermal laser, was used at an athletic event, an elite athletic event, in that it was at the level of an Olympic trials, and they had specific athletes use laser where other athletes didn't. The summation was that using laser and not allowing everybody to use it gave certain athletes an unfair advantage. It was almost like taking steroids. So it's very clear that when they did the studies, one of the big things was muscle recovery using non-thermal low-level laser, and obviously muscle performance, in addition to muscle recovery from injury. So lastly, the last question of the day is, and this, I saved this one because this is just exciting to talk about. What's your experience treating Hashimoto's hypothyroidism with the GVL? Well, interestingly enough, Hashimoto's disease obviously is the pinnacle of autoimmune disease. 75% of my patients that have a thyroid problem also have a leaky gut problem. So I use the GVL in the gut, in the gland area. There was a study that showed that when you applied laser therapy to the thyroid, that everybody had a reduction in the usage of Synthroid. So much so that 47% of the people after a 9-month period no longer had to use this particular drug. So the data is there. So it's quite exciting. Do we have any questions online? Quiet bunch today. Well, just so you know, I'm here every Tuesday at 2 p.m. I look forward to next week. My name's Dr. Rob Silverman. We'll see you Instagram. We'll see you Facebook and LinkedIn. Tap, TikTok. We'll see you soon. Take care.